My name is Basem Khalil and I'm one of the consultant children's surgeons here at King's College Hospital in Dubai. And today we will be discussing circumcision. Now that's a very common procedure that is done in this part of the world. And interestingly, it does cause considerable anxiety to some parents. So today we will try to allay some of those anxieties and answer some of the frequently asked questions about circumcision. I'll also try to dispel with some of the myths that go about circumcision around here. Now, if we are going to do circumcision in the early period, so in the first few weeks of life, that's usually done for religious or cultural reasons. We wouldn't do that for medical reasons in this age group at this stage. And so if we're going to do it for cultural or religious reasons, we will have a good discussion with the parents and answer their questions. Now, we would prefer that we do not do the circumcision in the first 2 weeks of life unless there are social circumstances or cultural reasons to do it earlier. And there's a reason for waiting for 2 weeks. You know, the first 1 week, babies lose weight, they gain their weight back in the second week. And also we would like mum to recover. Mum needs to recover. Mum is very key in the way we run our services in children. Now, if we agree that we're going to do it in 2 weeks' time, the next thing that parents usually ask is, what technique of circumcision is the best for my little one? Now, I always tell parents, we've been doing circumcisions for thousands of years. If you go into the ancient Egyptian works, you will always see a drawing of a circumcision there. And I always tell parents, you know, we've been doing it for thousands of years. There are probably thousands of ways of doing a circumcision. And if you go to what I call Dr. Internet, you're going to get even more confused because you might be seeing people saying this technique is better than this technique. And I tell parents, actually, no technique is superior to the other in its own right. All techniques are equal. Circumcision really depends on two things. It depends on the operator, the person who's going to do the circumcision. It also depends on the facility because sometimes complications happen. And if complications happen, is the facility able to deal with those complications? And so if you tick those two boxes, parents, the operator is experienced and the facility is good, the outcome will also be very good, irrespective of the type of circumcision that the operator has decided to use. So try not to get into which one is the better one. They're all good, provided the operator and the facility are good. Now, one of the commonest types of circumcisions that people use, and we use it here quite a lot at King's College Hospital, is called the ring method. Or the Plastibell technique. It's a type of ring that is used to do the circumcision. It's very popular in the Western world for the ritual and religious circumcisions. It's also becoming more and more popular in this part of the world. And what it is, it's a straightforward procedure. It takes about 15 minutes to do, and we always start the procedure with giving a local anesthetic. So this is a little injection that we give around the penis so that the baby does not feel that much pain when the circumcision is being done. So it greatly reduces the pain of the baby that is undergoing the procedure. And then a special type of ring which is matched to the size of the baby's head of the penis is then placed on top, and it's tied there pretty tightly, and the excess skin is removed. And 4 or 5 days later, in most cases, the ring falls off and you've got a circumcised penis. I always tell parents, in way over 95% of the time, there are no complications of this procedure. In far less than 5%, there could be some complications. And you could say there are 3 most common complications from this procedure. And the first one is bleeding. Now, if you do it in a good facility, if you do it in a good facility, which has all the ability to control the bleeding very quickly, if it happens, you'll be fine. And what we do here in King's is we do it in a special room, and we very easily can control the bleeding if that happens. And usually what that means is you remove the ring and you can control the bleeding. And instead of putting the ring back, we can convert to another type of circumcision where we put tiny little stitches, and those stitches don't need to be removed. They can dissolve on their own. And sometimes some people would even use something called the surgical glue. And again, that's another technique. And again, as I said before, all these techniques are out there. It really depends on the operator rather than the technique itself. And the second complication that can happen, as with any surgical procedure, is infection. And if that happens, the baby will get treated for the infection. But I always warn parents, this is something very important, I always warn parents that the first few days after the circumcision, the penis actually does look a bit awful to the eyes of the parents because it is swollen, it's red, the healing process is taking place. And parents get a bit worried, is this normal? Is my baby crying because they're in pain? And it does raise a considerable amount of anxiety. And I always say, look, this is part of the normal healing process. But of course, if you're worried, you can always contact your doctor to see and to have a look at it. We have an open door policy here at King's College Hospital in Dubai, where the parents can contact us at any time to have a look at the baby. Now, the final thing is sometimes the ring stays for a bit too long. So 4 or 5 days is the usual time it falls off. It's designed to actually stay for longer. But around here, in our own practice here at King's, we always say, if by day 10 it hasn't fallen off, then just come back and see us, and we will probably have a look and remove it ourselves. But these are all less than 5%, way over 95% of the time, none of these things do happen. Now, the aftercare is something that worries parents. They're worried, do I hold my baby? Can I hold my baby up onto my shoulders? Can I put them in the car seat? They're always afraid they'll do something that hurts the baby. And I always say, no, don't worry, the babies actually do tolerate this pretty well. So yes, you can put your baby in the car seat. Yes, you can put your baby on your shoulders. Treat your baby normally. Your baby will be fine from that perspective. I would always say, from the following day, you can bath the baby normally, shower the baby normally. And there are several ways of looking after the baby after the circumcision. And everybody has their own technique, provided, again, the operator or your doctor who did it is experienced. There is no harm in following any of the techniques of aftercare with the baby. They're usually pretty straightforward, and the babies tolerate it very well. So, I hope I've answered most of the frequently asked questions that you may have on ritual or religious or cultural circumcisions. Please remember, this is not the same as when we do circumcision for medical reasons. That's a completely different chat. It's a completely different discussion on what we do in these other children. Finally, I always tell parents, please make sure that the doctor who examines your child prior to doing the circumcision, because there are some times when we pick things up and we say, no, this is not for circumcision at this time. The baby may have another abnormality that says, no, we should not proceed with the circumcision. We will have to deal with the abnormality first. So again, coming to the experience of the operator and the facility that it's being done. In most cases, it should be straightforward. And I always tell to the parents, well, first of all, congratulations, you've got a new baby. That's the most important thing. If you have any further questions, or you still want to see any of us here at King's College Hospital, London, here in Dubai, please do reach out to us and we'll be happy to see you.